Hello, and welcome back to the Let Me Add to That podcast. My name is Elizabeth Graswich, Executive Director of Public Affairs and Communications at the Los Angeles County Office of Education. We are the largest regional education agency in the United States. We serve 80 school districts and nearly 2 million children. We are excited to use this platform to take a deep dive into the conversations surrounding our students and schools in LA County. April is National Child Abuse Prevention Month, a time to raise awareness and, most importantly, take action to protect the safety and well-being of children and youth in our communities. To properly address the topic, we are joined by two incredible guests, Dr. Tamara Hunter, Executive Director of LA County's Mandated Supporting Initiative. Hi, Dr. Hunter.
Hi.
And Alicia Garoupa, LACOE's Chief of Wellbeing and Support Services. Welcome, Alicia.
Hello.
Both Dr. Hunter and Alicia have a background in helping at Promise and systems involve children, youth, and families. Thank you both for being here today. Now, over the years, we've shifted from mandated reporting to mandated supporting. Can you explain the importance of reframing the terms and what they mean?
Yeah, sure. Happy to. Believe it or not, the term mandated supporting is actually controversial in some circles. Some people believe that you can't mandate support, and I, of course, disagree with that. I'll start by saying that we have given people, just based on where they happen to work, this incredibly consequential responsibility, and we've frankly utterly failed to prepare them for it. To be clear, I always like to make this clear, there is a need for a mechanism that allows for people who come into contact with vulnerable children to alert Child Protective Services to safety concerns. There's a critical need for that. But mandated reporting in its current iteration is deeply flawed and it's deeply harmful. Mandated reporters have been conditioned to believe so much that is just not true. They've been conditioned to practice in ways that are harmful and actually undermine child safety. And I think we'll talk a little bit about that later in the podcast. Mandated reporters have also been conditioned to believe that they just have a binary choice. They either report or they do not report suspected child abuse and neglect. And there is a third option, and that's what this work is really about. It's undoing that conditioning that we've drilled in folks for decades, and it's also about dismantling this way in which we've created a system that pits the best interests of a mandated reporter and their organization against the best interests of the families we serve. This work is really about expanding the proverbial toolbox that mandated reporters have to help them meet the needs of children and their families in ways that are proven to keep them safe.
And if I can add to that, I think it honors that, again, child abuse reporting is essential. There's been a mechanism to do it. We now have an opportunity to evolve in our understanding of what it means to keep kids safe. And some of that, which Dr. Hunter alluded to, is around empowering mandated reporters through training and tools to better support child well-being and family well-being more holistically. And with some legal changes that have taken effect and some really, I think, tremendous leadership on the part of LA County, we are well positioned to support this transition to mandated supporting.
And who qualifies as what we once said was a mandated reporter and now we're saying is a mandated supporter? Who qualifies as one, and what are their legal responsibilities when they suspect child abuse or neglect?
In California, we have 49 different categories of mandated reporters. These include professions such as law enforcement, education, mental health, so therapists and counselors, medical professionals, physicians, nurses. It also includes firefighters, EMT professionals. It includes school bus drivers, anyone who touches a child likely falls into the category of mandated reporter here in California. And mandated reporters are required by law to report known or reasonably suspected child abuse and neglect to a local Child Protective Services agency or law enforcement agency. That's it. That's the mandate.
It's so interesting because I think in education, we just think of it as us, but there's an awful lot of people that are out there and are taking these trainings every year.
Sometimes.
Yeah. Sometimes. That's interesting. Okay. Which I'm sure we may get into a little bit later. What are some of the biggest misconceptions about mandated reporting and child abuse that you frequently encounter?
Well, I can start by saying that one common misconception, and I should also maybe preface this by saying that over 20 years ago, I was a children's social worker for LA County's Department of Children and Family Services, and I did serve as a child abuse investigator. So I was on the receiving end of those calls from oftentimes, our colleagues in education. I think a common misconception that I came across back then that I think is still present today is that we can't clarify situations, right? There's this fear, I think, among people as soon as I think we're trained to kind of freeze when we encounter something that we're unsure about. And the idea that we actually have a responsibility to be responsible and responsive to what the specific circumstances are requires, I believe, that we sometimes clarify situations instead of making assumptions that can unnecessarily get a family involved with child protective services. I'd also say that it's a misconception that there's no harm in those reports, right? In the reports that are when there isn't necessarily a concern about child safety, but more, well, I better call this in because, I don't want to lose my job or my credential. And I'm afraid that what our training has done is that it's overemphasized the consequences for individuals and organizations, and it's actually underprepared professionals to discern what is actually reportable. And so those sort of, I better do it to keep my job, actually does often more harm than good. So I think there's a misconception that there's no harm in any child abuse report, when in fact I think that's incredibly untrue. And I, again, as the person knocking on the family's door, just putting ourselves in the shoes of a parent or caregiver, having someone knock on your door and say that there's a concern about someone's reported a concern that you may not be taking care of your child. From the vast majority of parents, that is a gut punch. And of course, there are times that that's necessary, but there is a consequence to those calls and an impact on, I think, especially for us in schools, the relationships that we have with our families. So when it's not necessary, it actually can still do damage. Another misconception that I think about a lot is, as a person in child welfare and attendance, we had situations where school personnel thought that it was appropriate to call around attendance concerns, and that the Department of Children and Family Services would intervene or somehow involve the family in child welfare based on a child simply not attending school. And the reality is that Department of Children and Family Services will send that right back to the school district or to the other, the LEA, charter or district, because that is not really in the jurisdiction of DCFS. And then the last thing that I would say, honestly, is that in LA County, the child welfare agency is called the Department of Children and Family Services. And to my mind, it's a bit of a misnomer because it is a child protective services agency. This is not a number that a family is going to call when they're seeking support or resources. This agency's intention is to investigate situations that involve child safety and life and limb. So I'm afraid there is also a misconception that, at least a social worker is going to go out and can kind of provide the family with resources, when that's not necessarily their mandate, and that may actually not be the result of a call that's made.
If I may add to that, I just want to underscore everything that Alicia just lifted up and sort of double click on all of that. Our work to reform mandated reporting began with educators, because we have such champions in Alicia and Dr. Eduardo. And when we've engaged educators throughout this county, they are most often surprised by the fact that these reports that you make just to cover yourself when you don't really suspect child abuse or neglect are in fact not harm neutral. To Alicia's point, it's a knock on the door by Child Protective Services is not comforting. If a family's going through hardship, it's actually compounding A lot of mandated reporters are really surprised to learn that every report that is made is a strike on a family's record, even when an investigation has determined that abuse or neglect is not occurring. That's what's most surprising to many mandated reporters. It also, another consequence of these sort of unnecessary reports, just to sort of cover yourself, is the way in which it overburdens our child welfare system here in LA County. The director of our Child Protective Services Agency, Director Brandon Nichols, once said, and it's just such a powerful quote that we lift up every chance that we have, but he said that there's so much smoke that my people can't see the fire. And that is just so profound and really underscores at least one of the ways in which this policy is failed and misguided. The last thing I'll say about this in terms of misconceptions about mandated reporting is this notion that what we are doing currently, right, the way that we currently practice and enact this policy is somehow a necessary evil to keep children safe. It's not true. That's a fallacy. There is a better way to go about this.
Yeah, I think that's something that I've found really profound in my conversations or when I've heard from either of you on this topic, because it is that face of what actually happens after. And, you know, for the vast majority of us in K-12, we're here for kids, right? And they are trying to do the right thing, but they don't see what happens after they make that call. And so I do think, you know, sharing that information has been so powerful, which really gets me to the next question, because there is a lot of fear. And I think, Alicia, you made a great point about our trainings, and I have taken that training. I'm a mandated reporter. I've taken that training every year. There's a lot of fear that's imposed by those trainings, and, you know, making sure you're following what you're supposed to do. So, you know, what challenges do mandated reporters face when they're deciding to make a report?
Well, I can start by saying, as Dr. Hunter mentioned, the lack of training and preparation for actually discerning what is a child safety issue, what is abuse and neglect, what is the jurisdiction of our child welfare agency, I think is the first piece of information that is sort of missing. So back to sort of our reflexive response being, well, I better not. I need to just make a call. And I think with that, I know Dr. Hunter often talks about also this sort of idea of moral injury to the mandated reporter themselves, that there is a conflict around calling when maybe your gut is saying, this isn't really a child safety issue, but I don't want to get in trouble. So I think that feeling of conflict is actually really hard. I know I've been with teachers or staff when they were making the report and sort of concerned about the damage to the relationship, et cetera. Again, when it is necessary, when there's a legitimate child safety issue, we do what we need to do, right? We are mandated reporters. But when our concern is more around, again, individual or organizational liability as like our primary driver, I think that puts mandated reporters in a difficult situation. So I think a lack of training, adequate training, decision supports, means of consultation. Also, you mentioned this, Dr. Grasswich, that our training, I don't know what other folks take away. We've heard from a lot of mandated reporters, especially in education. For the most part, what we take away is you can lose your credential. We take away very little information about how to make good decisions about detecting when there is a child safety issue. Very little information about that. And I think that is where there are real opportunities for us to lean into this work and better support and prepare mandated reporters for this really important decision that they need to make.
Absolutely. And what I'll add is that, and Alicia alluded to this, but mandated reporters are oftentimes just confused. They're confused about the mandate. They are confused about just what reasonable suspicion is. That's a very vague and sort of opaque legal term. So it's just a very confusing process overall. I lift up another challenge that we have heard from mandated reporters, and that is the way in which they feel isolated and all alone when it comes to making the decision to report. There are very few professions that expect consequential decisions, and the decision to report or not report is consequential. And there are very few professions or fields that expect consequential decisions to be made in isolation. But this is what we expect of mandated reporters and the way that we've chosen to interpret the mandate as an individual responsibility that you must make on your own. And it's difficult for mandated reporters.
Absolutely. And, I think the numbers here in LA County are really interesting. What do those numbers tell us? How has child abuse increased or decreased in recent years, and what factors are influencing those trends?
Fortunately, child abuse is decreasing here in LA County, which is fantastic. The numbers of reports that are made to our child protection hotline remain consistent after we sort of bounce back from COVID. They remain consistent. In Los Angeles County, as is the case in California, educators and law enforcement are the top two sort of reporting professions. Mandated reporters make the most reports to our child protection hotline, and law enforcement and educators make the most reports of all mandated reporters. And that is consistent. It's been consistent locally, statewide, and frankly, across the nation. What is also consistent when we look at the data is the fact that educators have the lowest percentage of reports that turn out to be actual child abuse and neglect after an investigation has been conducted. I think the 2022 data tells us that 22% of all reports are made by educators here in LA County, and 5% of those reports turn out to be abuse or neglect after Child Protective Services has investigated.
Wow.
Yeah.
So to underscore what Dr. Hunter just said, and I think, I honestly, when I was a child abuse investigator, I think I knew this in my gut, right? I knew this in my bones that there was an issue with accuracy. What she spoke to is that about a quarter of the calls, right, 1/4 or 1/5 of the calls typically in any given year are coming from the education sector, but less than 10%, 6%, 5%, depending on the year, are actually substantiated once there's been an investigation by the Child Welfare Agency, which means 94, 95% of the time it didn't rise to that level, or there was not evidence or sufficient evidence. And I think that is really the opportunity, again, for us to think about what those other pathways are, to understand what training and support mandated reporters need, especially in education, because we are, kind of the front line. We're with children, and we do need to ensure and support their safety, but we need to be reporting the things that relate to child safety and also accessing alternatives when child welfare is not the right intervention for the family's identified need.
I'll add to that. The data also tell us that general neglect is by far the most common type of maltreatment that is reported to our child protection hotline. And that's important for a number of reasons. The first of which is that general neglect is by far the most subjective type category of maltreatment. It's broad, it's vague. In many ways, it's like a catch-all. General neglect is also most often conflated by poverty. So at times it can be very difficult for mandated reporters to discern between need and neglect. And at other times, it's not difficult to discern between the two. Biases about people experiencing poverty kick in and come into play. So I just wanted to make sure to lift that up. The general neglect is significantly reported to our child protection hotline.
Which leads to another heartbreaking fact, which is that research shows that certain communities, particularly marginalized groups, may be underreported or overreported. So what can we do to ensure that mandated reporting is done equitably and responsibly?
Well, I think I'll piggyback on what Dr. Hunter just spoke about regarding that conflating of neglect and poverty. Something that is still surprising to me over the last couple of years, we've been trying to tackle people's lack of awareness of Assembly Bill 2085, which took effect in January of 2023. It actually narrowed the definition of general neglect that is reportable, and it clarified that poverty is not neglect. Unfortunately, some of us in education may remember, I think it was about a decade ago now, a law had to be put into place to clarify that homelessness in and of itself was not reportable as neglect. So AB 2085 narrowed the definition of general neglect so that there needed to be a substantial risk of serious injury or illness associated with the lack of resources that there was a concern about. So given just how common, as Dr. Hunter said, this sort of general neglect reporting group is, I think it's really important that we lift how that law is intending to narrow the definition, help mandated reporters better discern what should be reported, and start to tackle some of the conflating of poverty with child abuse or neglect, as well as addressing the role that bias is playing in our decision making. And I think when we think in education, some folks are well versed in this concept of vulnerable decision points, right? So when we think about things like willful defiance, right, these sort of vague, emotionally charged situations that we come across in education, child abuse reporting is another one of those. So in a vague and emotionally charged situation, we're human. Bias creeps into those decisions. And we really do need decision supports and strategies to sort of mitigate and check ourselves for those biases. So just another thing to lift, this law has presented us with an opportunity in the county to really support compliance for individuals and for organizations to start to tackle some of the ways that our system has been set up to not actually necessarily serve the safety and well-being of children and their families in certain circumstances.
Alicia lifted up willful defiance, and I want to take that and expand on that a little bit more because in the child welfare system, racial disproportionality impacting Black and Native American children and families is positively pervasive. It is not unlike what you see in your systems in education with Black children when it comes to school discipline and things of that nature. It's extremely similar. And again, the racial disproportionality and disparity it's pervasive, it's rampant. So Black children in LA County comprise about 7.7% of our general population, yet they are the subject of 19% of all reports that are made to our child protection hotline. So they are reported at twice their rate in the general population. They are, at any given, 19% of all investigations are conducted on Black families on any given day in LA County. They're 21% of our our foster care population in LA County. And they go on to be 38% of all children who age out of the child welfare system and are more likely to fall into homelessness, into the criminal justice system, or back into the child welfare system as a parent. And it all begins with a report that was likely made by a mandated reporter.
That's incredible. Very sad data to share. You know, many argue that the system is reactive rather than proactive. What are the best strategies for preventing child abuse before it happens?
The best way to ensure that children are safe is to ensure that their families are healthy and well in the broadest sense of those terms. And we can prevent child abuse and neglect by bolstering the protective factors within families that have been proven to keep children safe. So that involves things like ensuring that families have access to concrete supports to meet their basic needs, ensuring that parents have healthy relationships and social connections and are not socially isolated, to build up social and emotional competence in children, as well as strengthening parenting skills and knowledge of child development. These are all examples of known factors that keep children safe and mitigate risk.
And if I can add to that, I like to say when I'm talking about parenting, I myself am a parent, but the idea that acknowledging that parenting is the hardest job that most of us will ever do, it can be very isolating. And when our systems, places like schools, are places that are welcoming, that are supportive, are places where families can access resources, brave spaces, right, where you can go to somebody if you have a need or a concern. Those are the spaces that we know all of our schools should be and that we want for our kids and their families. I think a piece of that is providing supports around parenting. And as Dr. Hunter mentioned, the issues around, sort of supporting child development. This is a difficult job. It's difficult at every stage. Children will challenge us. That's just what they do. It's a gift. But when a family is vulnerable and feels isolated and also lacks that social network and support, I think that's when when kids are actually most vulnerable. And this is where I think schools are uniquely positioned to be a resource and to be a support both to the child and also to their parent and caregiver.
Absolutely. Schools are natural touch points. And this is another reason that mandated reporting in its current iteration is so misguided and problematic. When families are afraid to turn to the institutions that they should be able to go to, like schools, pillars in their community, for help when they need it, they go underground, and that makes children less safe.
One of the things I know you're striving to do is shift mindsets. And so for educators and school staff and all the others who are working with our children, what are the most important things they should know about their role in child abuse prevention and reporting?
I'll say that they should know that they are on the front lines. Oftentimes they spend the most time with children. I think that it's incredibly important that educators know that the decision to report suspected child abuse and neglect or not report it is life-altering, and it should be treated as such. I think that we've developed some tools and some products that we believe will help mandated reporters with this consequential decision. We heard from mandated reporters that they feel ill-equipped, unprepared, and unsupported. So Alicia spoke about the training that we developed. We developed a training supplement on general neglect that includes a decision support process, includes a decision tree for mandated reporters to use. So we certainly encourage them to take advantage of the tools and resources that are available, that are forthcoming. We're working on other products to help them get it right when it comes to this important decision.
And I'll add to that, the decision to report or not report is based on an individual's training and experience. So to the extent that we can spend more time and provide better training and better support for mandated reporters, we will end up with better decisions. And Dr. Hunter alluded to the community support pathways. I don't know how many of us, when we received our child abuse training, got any information about alternatives to reporting or sort of how to provide support to families or who on the campus, your McKinney-Vento homeless liaison, your community liaison, your school social worker, your counselor, your nurse, your health office staff. Who are those folks that can help connect a family with resources? That has not naturally been part of the training and support we provided to mandated reporters, but I believe not only can it be, but it absolutely should be. And a lot of the work that Dr. Hunter has really led and championed in our county, again, this AB 2085 training is a first step toward providing better training, better decision supports, and alternatives to reporting when that is the most appropriate path in service to a child and their safety and their family.
And the reality is that child abuse, unfortunately, is real. And there will be times in which mandated reporters, it is appropriate for them to make a report. But you can still be supportive of families. You can still lift up and elevate the strengths that they have. And mandated reporters can still connect families to supportive resources, even when a report to the Child Protection Hotline is required.
Thank you for that. And as we close, it is Child Abuse Prevention Month. So what can anyone, not just mandated reporters, but anyone do to help prevent child abuse?
I would say along the lines of what Dr. Hunter shared, empowering oneself, taking training, getting informed, getting empowered. We're offering, the training that's available is free. The county's training, supportingfamilies.lacounty.gov. UCLA is hosting a training portal. Take the free training, explore the tools, and then use them when you need them. Stay engaged. Again, find ways of being supportive in your community. Exploring the Family Resource Finder, I think, again, on the supportingfamilies.lacounty.gov website. knowing what resources are in your community and having the ability to make those connections when needed is also very powerful. And based on your position, within your organization, if you're in a position to champion broader training to support your whole organization to move from mandated reporting to a mandated supporting model, we're looking for organizations to partner with in order to make sure that this work has legs and that we take sort of a long road. Again, this is going to take time because child safety is extremely important and nothing that we do should compromise the safety of children. We believe that this approach actually makes children much more safe.
I want to thank you both, not only for your insight, but also for your passion and dedication to this sensitive but really important topic and work. If you want to learn more about child abuse prevention, including trainings and resources, visit www.lacoe.edu/mandated supporting. Thank you so much, and we'll see you next time.
Please follow the Los Angeles County Office of Education on Instagram, TikTok, and Twitter at Los Angeles COE. That's Los Angeles COE. Or you can find us on Facebook and LinkedIn at Los Angeles County Office of Education.